one of the challenges we're having in rectal cancer, especially for localized disease, that to date we don't have yet prognostic biomarker or even predictive biomarker to chemoradiation. So when we treat patients with chemorad, we don't know who actually will respond and who will not respond to treatment, and who will relapse after that. So in the era of precision medicine, there is a huge interest in trying to identify a biomarker that can predict response and relapse. And if we can do that, perhaps we can tailor our therapy, especially in the adjuvant setting, towards those patients. Our study was, the question of our study was mainly to try to examine two things. The first one, what are the microenvironment and molecular changes that result from radiation or chemoradiation? And the second question was, is any biomarker that we can identify that can correlate with response? We included we looked at many patients, but we ended up with about 60 patients with localized rectal cancer, because we needed pre-treatment biopsy as well as post-treatment biopsy, which is a surgical biopsy. All patients in the study underwent neoadjuvant chemoradiation with either Xeloda or 5-FU, and subsequently had surgical resection of the primary tumor. So we examined both pre and post-treatment. And one of the interesting findings that gene gain in the MIK67 was correlated actually with the relapse. So among the patients who relapsed, majority of them had overexpression or hyperregulation of that gene, which I think we need further study to validate that. But to my knowledge, this was the first one to be detected in rectal cancer.